Hey guys, welcome back to your channel Dr. Battisi, and I'm your dentist Dr. Jasmine. So this video was like on not on my priority for a while, but as I was really getting busy with the clinic and not being able to come more often active on social media, I realized that this is one of the most important videos that I have to make, because I don't think if you are in a clinical practice तो इससे ज़्यादा ज़रूरी कुछ भी है. So we will starting with the dentist के basic etiquettes, and we will be going towards the dental patients के basic etiquettes. So guys, for the dentist, very firstly, hair should be inside. आपके बाल अंदर होने चाहिए apron में, either in a bun. If you have a long hair, you can have the head cap. You can have, in the clinic we have a fan on the roof, and behind me one there is fan on the wall. So ऐसे sometimes the hair is there, so I have to wear either a really good, nowadays cloth hair caps are available. You can go ahead with that. You can customize them, and or you tie, hair band लो अच्छा सा. You have to like पीछे scrunchies लो अच्छे से. Either whatever, your hair should be inside completely. Second is be on time. That sayings are gone, that doctors are late. Good doctors के लिए हमें wait करना चाहिए, तो it's okay. It's nothing like that. Please be on time. If of course there is nothing emergency, or you are not in some other clinic or attending some other patients, but be on time. Third, listen and understand the patient very carefully. Of course, we know, we have been seeing the patient since the third year of BDS, and we know all the diagnosis and what is the patient going to say and everything. But each case is different. Listen and understand the patient, because वो patient आपको hints दे रहा है, signs दे रहा है of what the diagnosis exactly is and what treatment he or she will be choosing. Because there is no MRP, like अच्छा scaling करानी है, this is the MRP, यही fixed rate है. Every case, every tooth, everything is different. Number 4, have patience and calmness. If you have these two, 50% of the treatment is done. Trust me on this, and especially with elder patients and kids. Number 5, learn to say no. Some patients have beautiful white teeth, but they keep on insisting that they want to get the teeth whitening done because they saw some celebrity. They have the most beautiful teeth they as a person can have, but of course you can go ahead with the teeth cleaning and whitening, but they're very adamant on a particular treatment. So then you have to say no. They will be forcing you for some treatments which, as a dentist, if it is not okay to you ethically or any otherwise, please learn to say, and it is okay to say no. Number 6, there is no shame, no problem in saying I don't know, or we will be contacting the experts or calling the experts. No one, no matter how much experience they have, can have all the knowledge, can 100% be all right all the time. It cannot happen, no matter which dentist you are talking about in this whole world. So sometimes saying that I don't know about this, but yes, I will revert back to you, or we will discuss your case with our team on the panel, or with our seniors, or with our team, or anybody, or the experts in that particular treatment, be it perio, OS, ortho, whoever it is. But it is okay to say I do not know. Number 7, genuine suggestion, and give all the options you have. Sometimes what we do is, we try to choose on behalf of the patient, unless you are asked to by the patient or very genuinely. Do not do so. Just give your genuine suggestion that this is the thing, this needs the treatment, and these are the options available here if you get the treatment from me. That's it. Trust me guys, patient will come back to you, number 1, and will trust you with his or her whole heart. Sure. and will spread the message that you should go and visit this dentist. So guys, these mostly seven majorly are the basic etiquettes I would, being a dentist, would suggest and share from on my behalf. Let me know if you think about there is something I missed, or there must be more listed to it or addition to it. Now let's come to the dental patients part, a very important thing. I hope, because we all are dental patients, no matter if we are dentists or doctors or not. So, all the dental patients, please listen to this. Be on time. If you are late, please inform the clinic. Just give a call. It will hardly take 1 minute to do so. Cancel, inform them as soon as you are confirmed that you will not be able to reach the clinic or visit the dentist when the appointment is given. Take appointment. That is another one. This is the second. Take appointment, that is preferred. Of course, if it's not an emergency, or you are not just walking in, roaming around, and just see a dental clinic and thought, oh, let's get a cleaning done, or let's just, if it's not a walk-in or OPD, like, take an appointment, please. Number three, a very important one for all the ladies out there. I shared that on Instagram, dr.battisi, as well. Please, all the girls, all the ladies, you are beautiful. Your smile is healthy, we make sure of it, but you have to remove the lipstick before coming in. It's a dear suggestion from us, because it sticks on our instruments. It We are not comfortable with that. Apply gloss, apply Vaseline, something which is not so strongly tinted, and not strong colors. Very, not lipstick, no matter if it's nude also, but just a gloss cream would do. But please remove lipsticks and come. Number four, throw the tissues you get in the dental clinic in the dustbin, preferably a dustbin which has a black bag, because the dustbin near you might be red, yellow, blue, different colors. You do not have to throw them in that. Please throw them in the dustbins. Ask the dentist, or you can leave it there where you are doing rinsing and spitting out, or on the chair, because after you get up, before the next patient comes in, chair safai hogi. So please, आप वो टिश्यू पेपर डस्टबिन में ही फेंकें. So we are waiting for our turn, and before us there is some other dental patients, so we tend to drink a lot of water. That is completely fine, but we tend to use a lot of glasses. So please use one glass. I'm not saying that it would be really expensive for the dentist, or you must not use it, but for me, if I'm using multiple glasses, it's just a waste. So I take one glass. It's my responsibility that my glass is mine, and I throw it in the black dustbin, and I use it just once. Matlab, for that particular day, you are using one glass and not multiple, like drinking water, one glass throwing out, like drinking water, another glass throwing out. So just for that, I'm saying you can bring your own water bottles, preferably copper if possible. That's the best. If if anywhere we go, it's like saving, and like saving money, saving energy, saving, not creating more waste. So that is the best. Without consultation, please do not go ahead with any medication, be it just a painkiller. Pain बहुत ज़्यादा हो रहा है, contact your family dentist. Have a painkiller, but do not take antibiotics, or do not become dentist by yourself just by Google. Please don't do that, please. It will hardly take a one call. If you do not want to consult and visit them, at least consult them on, like, on call, please. No home remedies. Dentistry needs work. Whatever you do is temporary. Dentistry needs work. So please understand that. And why I say that every 6 months or 1 year at least you should get a cleaning done, because we clean every surface of the tooth where your brush or the floss cannot reach. So even a small, minute caries lesion, small pit, small dot of caries, which is caries, can be pointed out and can be filled right and then. Because we tend to ignore that, small becomes big caries become RCT, big RCT becomes extraction and then removal of the tooth, of course. So please, why you have to go through this whole process? Just get a cleaning done once a year. This irritates me a lot. Matlab, isse I really get irritated and frustrated if I see this. It's parents doing this or patients doing that by themselves, like putting finger, like doctor sahab yahan dard ho raha hai, yahan. If it's a back tooth, it's like putting your whole finger back in the mouth, and it's really is frustrating. Your hands are not always clean, no matter if you enter the dental clinic you are getting hand sanitized, but please don't do it. Just ask, there are various instruments, PMT, probe, mirror and tweezer, kept right in front of the dental chair. If you're even visiting for the first time, just take one thing and either or have a cotton on your finger and then say, or either just has one instrument back of it, you can show it like here it is paining or here it is paining. Otherwise the dentalist of course understand, he or she will not proceed until you, like, the problem is confirmed. So do not worry about it, but do not put fingers, especially parents, in your child's mouths. It's I just yuck. I just like to say, oh, ask questions, all doubts, clear everything you have, but don't become Google, as I mentioned earlier. Please don't do that. Have your all doubts cleared, go home, investigate, research, whatever you want to do, compare. So no dentist, no two clinics, no two patients, nothing can be compared. This is a request, like, maybe it depends on every clinic. So if you are getting a treatment done, most probably the dentist will say that pay half amount or some percentage of that amount. Even if not, if the dentist is saying okay, pay small amounts in every appointment, please do that. Pay per appointment, if your whole, like, most of the payment is not done, because if we do some major treatment and the payment we do not get the pay for it, so it doesn't feel good. Like, it's like an appreciation, you are thanking the dentist for the same. If you buy something, of course you have to pay, right? You cannot taste a burger from the McDonald's without buying. Of course we have like ice cream parlors, but that is where you taste the ice cream before buying, so it's a very small amount. So that cannot be compared. But anyhow, please, if you visit and you have multiple appointments, pay per appointment if possible. If not an emergency or urgent, please don't text, don't call the dentist after the work hours, especially guys. Like the good morning, good evening, how your day, have you had dinner? Please, guys, we are super tired after the long working hours. We have our privacy, family, have after work life also. So please don't go it. Of course, if there is pain, emergency, anything you need to ask, everything, anything, please do so, but not those. I hope you understood. This I experienced lately. Like, a patient was advised for an OPG, that is the full mouth x-ray. So he was delaying it. So, and first few people do not take warm saline rinses seriously, but I guess that's the magic drink, I name it, and have put it on the website www.drbattisi.com as well. So if you choose the doctor, if you trust him, if you are getting the treatment from him and you're okay with it, please do what is suggested by them. Please do. Because if we suggest something, or if we need you to do something, it is really important. It's not like we are giving you unnecessary x-rays or ultrasounds or whatever, MRI scans or whatever, 3D thing. But please, whatever is suggested, have your doubts cleared, everything done, but please do so. Don't visit with your whole family. Of course, if it's a child, if it's a kid, parents should come, most welcome. Of course the siblings should also come, but except that, if the patient is old, of course caretakers must come. That is fine, guardians must come. But guys, please, if the patient is one whole family consisting of 5 to 6 people, please don't come. COVID, one thing. Second, our sterilization protocol. Third, it's like whole family is there and one assistant, and I'm the dentist and the patient is here. It's like, you have so many questions and everything. It's not comfortable. Please, it's not a restaurant. Please, just understand this. Of course, if there are five people coming together and all the five are dental patients, that's a different story. But please, this is I'm requesting. It's not a harsh and fast rule. I'm just sharing it. Like, if you're really happy with the treatment, really satisfied, what happens? I'm not comparing. I'm just sharing that in other abroad countries, the dental patients bring gifts for like a thank you note, gratitude note, best wishes for the dentist, be it a single flower, be it in there is a patient and she got sevai. I was really happy with that. So patients are really grateful to you, and we do a lot that if you're paying something, we are equivalent, contributing to it, like we deserve it. So just in case, just a handmade note, a thank you note, just something. I'm not saying to be gift something like it should be price, like a heavy price. I'm saying things which are priceless. A good thank you note, a gratitude note, it feels really good, honestly. Just a happy, healthy smile is what we need. But if you say thank you, anything, any small thing, a token of appreciation, we are over the moon. Each one of us, no matter how many years of experience or how many cases we have done, we are over the moon. Thank you so much. But these were really important to discuss because we need to send the message out that these things are okay with us completely, but these are not. And if these can be worked upon, it's such a dental clinic is such a happy place. It's like a family, be it patient, staff, or anybody. So thank you so much. See you guys in the another video and take care. Bye bye.